My name is Dr. Irfan Bashir. I'm a radiation oncologist by profession. So today we'll be discussing about lung cancer. So I'll be giving a brief account about the lung cancer. What are the signs and symptoms the patient presents with, and what is the treatment, and what are the preventive measures that we can do for preventing lung cancer. So first, let me tell you about the incidence. So lung cancer is the commonest cancer among males as well as females. The commonest cause of lung cancer is smoking. So earlier, lung cancer was more common in men, and in women we had the breast cancer, which was at number 1. But now in women we have lung cancer again at number 1 position, because the smoking is very common in women as well. So in addition to smoking, there are other risk factors like asbestos, radon, exposure to pollutants that are responsible for causing lung cancer. Once a patient comes to us with all these symptoms, the preliminary the diagnosis or the investigations that we do include a complete blood count, including a liver function test, a kidney function test, and a specific investigation like a CECT of the thorax, and then we also do a CECT of the abdomen to rule out distant mets. And nowadays we have a PET scan, which is a single investigation that investigates the entire body, including the lungs and the other organs as well. Then we need to establish the tissue diagnosis. For a tissue diagnosis, we either do a bronchoscopy and a biopsy, and for peripheral lesions we can do a CT guided biopsy as well. Once the diagnosis is established, then we go to the treatment part. The treatment of lung cancer is it's a multimodality treatment. So lung cancer patients can be treated with surgery, with radiotherapy, as well as with chemotherapy, or a combination of any of these. So depending on the stage and what the symptoms the patient has. We have radiotherapy, which is the radiation oncology, and then we have the chemotherapy, which is done by a medical oncologist, and then we have the surgery, which is done by a surgical oncologist. The surgery that's usually done includes pneumonectomies or lobectomies. The chemotherapeutic agents that are used in addition to the routine chemotherapeutic agents, nowadays we have targeted therapies as well as the immunotherapies, which have shown excellent results in lung cancer. And as far as radiation oncology is concerned, we have in addition to the 3D and the IMRT, IGRT, the techniques, we have the gating as well, because lung tumors they are moving tumors, and we track the tumors while we are treating them. And as far as the prevention part is concerned, so the only thing I would suggest, and I would as a part of our awareness and campaigns which we usually do, the only thing we tell to patients is quit smoking. So that's very, very important, because if we quit smoking, patients, the general public quit smoking, the burden of the lung cancer will drastically decrease. Thank you so much.